Hello, Mrs. Hartley. My name's Dr. Peterson. I'm one of the doctors on this ward. I wondered if I could do your patient interview now.
Yes, sure. I've been waiting a while now for someone to see me.
Yes. I'm sorry you've had to wait so long. I'm afraid that I had quite a backlog of work to do when I arrived on the ward.
That's okay. I know you're very busy.
Before we start, I'll just draw the curtains around the bed to give you some privacy.
Thank you. These multi-bay rooms are not very private at all.
No, they're not ideal. I'll just bring a chair up so we can talk more easily. Is that okay for you?
Yes, thank you.
So, as I said before, I'm going to ask you some questions about your recent health. Would you like to tell me why you came into hospital today? I'll take a few notes while you're talking, if that's okay with you.
Oh, yes, that's okay. I don't know what the problem is, really. I'm just so tired. Like, all the time. It's not as if I have a busy job or anything. I mean, I just work in a florist shop. It's not busy at all, and I don't have to start there until 9:30 in the morning. One of my friends said maybe I'm anemic. I became vegetarian a couple of months ago, and I'm not sure if it's good for me or not. I was going to go to the GP and have a blood test, but then I started feeling awful, so I came into hospital. I've lost a bit of weight too. I just don't feel like eating much at all. I've always had a lot of trouble with urine infections. I don't know if that has anything to do with the way I feel. Actually, I was here a few months ago after a really bad bladder infection. The GP gave me antibiotics for it, but they didn't work. I ended up on a drip. I haven't had another bladder infection since then. That's it, really. Oh, sometimes I feel a bit breathless too, for no good reason.
Right. Thanks for giving me that information. I did have a quick look at your old notes, and I noticed that you were in hospital a few months ago. That was when you had the bad bladder infection, right?
Yes, that's right.
Okay, let me just go through what you told me to be sure I've got the correct picture of what's happening here. You've suffered from urine infections for some time. Now you're feeling tired all the time, although you don't think the tiredness relates to your job, correct?
No, I really don't think it's the job at all.
You've recently changed your diet to a vegetarian diet, and you've lost a bit of weight too. How much do you weigh now?
I think I weigh about 62 kilos. I've lost about 4 kilos in the last week.
Right, I see. You mentioned anemia, and you said that you haven't had a blood test to check your hemoglobin level.
No. Maybe I should have a blood test.
I'll talk to you about some tests in a minute, but I'd just like to ask you a question about your family's health. Is there any kidney disease in your family?
Yes. My mother's had kidney disease for several years. She does okay, but she has to be careful. Is that what I have?
I can't be sure what is causing your symptoms without doing some tests first. What I'd like to do is send off a blood sample to check your hemoglobin level and your kidney function. I'll also ask the nurse to do a urine dip to check for protein in your urine. We may need to do a scan of your kidneys too, but that can wait until we have the results back.
Oh, I didn't even think of kidney disease. That's awful.
I know it's a lot to take in at once. When I have your blood test results back, I'll have another chat with you. Is that okay?
I suppose so.
Is there anything else you'd like to ask me before I take the blood sample?
I don't know. It's all a bit of a shock.
That's okay. If you think of something later, just ask the nurse to call me.
Thanks.